afternoon, everybody. I'll start off again with the Public Health Hero of the Week. This week, we want to recognize Dr. Tim Stebbins, the current Crawford County Health Officer. Dr. Stebbins, who also serves as the Director of Ascension Via Christi's Emergency Department in Pittsburgh, took on the role of the Public Health Officer following the resignation of the previous Public Health Officer. He quickly rose to the occasion, providing recommendations, support, and advice to Crawford County Commissioners as they work to protect their community from the spread of the virus. Crawford County schools, businesses, and residents are safer thanks to Dr. Stebbins' willingness to take the lead during this time of crisis. So to Dr. Stebbins, thank you for stepping up and protecting your community. Now I'll move on to the numbers update. Since Monday, Kansas has reported 4,539 new cases and 100 new deaths. This brings us to a total of 252,041 cases, 7,540 hospitalizations, and 3,355 deaths. After an unfortunate spike in cases over the past weeks, today I am pleased to report that Kansas is one of only 3 states seeing a downward trend in COVID-19 cases, according to Johns Hopkins University. The past 10 months have been a long and challenging road, but at this time, case rates are going down in our state and vaccine distribution is ramping up. Speaking of vaccines, as of this morning, our state has now vaccinated 93,885 Kansans, according to our state's reporting system, WebIZ. We have also made significant progress in closing the gap between the CDC's COVID-19 data tracker and our actual vaccination rates. A little over a week ago, all of you may remember, because I think you reported it, that the CDC had ranked Kansas as one of the lowest states in the nation for vaccine distribution, which, as I said last week, was not accurate because of the data lag. Now, due to a significant improvement in the reporting data, Kansas is in the top tier of states providing COVID-19 vaccinations. In fact, I just heard that we have moved up to 17th. Our state is currently wrapping up the first phase of the vaccine administration to healthcare workers and other essential personnel. The distribution plan was designed to prioritize the health of our most vulnerable populations. Now, the federal government is recommending that we add about 50% of the adult population to the first wave of vaccines. But when we talk about their first wave, I need to remember, the federal government labels their phases a little bit differently than we do. They do 1, 1B, 1A, 1B, 1C. We go 1 and 2. So that's why we can feel comfortable that having our 65 and above works. Because we actually, when we expanded phase 2 to all Kansans over the age of 65, we were actually preempting the CDC. I remain steadfast in our objective of vaccinating every Kansan, and we believe that Kansas's plan will achieve this objective in an orderly manner. Our team continues to monitor the effectiveness of vaccine rollout to ensure that everyone is vaccinated and that no vaccinations go to waste. As we prepare to enter phase 2, we are working to ensure we have an adequate network of providers to care for our citizens. We have agreed to participate in a national pharmacy partnership to increase the number of available vaccination sites across the state. Over the course of the next week, we will be providing more information at what sites eligible individuals can receive their vaccines. In terms of shipments, this week we received 3,900 doses of the Pfizer vaccine and 66,000 doses of Moderna. Of the Moderna shipment, 17,000 of those doses are prime, which means they are used for the first vaccination, and 49,000 are booster, the second vaccination. As always, vaccination information can be found on kansasvaccine.gov, and always wear a mask, wash your hands and keep your distance. As you all know, we've had a busy few days here in the State House. The 2021 legislative session began on Monday. I gave my annual State of the State address last night, and today I announced my third budget recommendation as governor. I crafted the fiscal year 22 budget with the utmost care, following months of input from my budget office, my cabinet, and many other stakeholders. Now, I'm pleased to say that even as we navigate the COVID-19 pandemic, my budget is fiscally sound. It maintains investments in core services like education, infrastructure, and economic development. It upholds my administration's commitment to protecting funding for behavioral health services and includes funding for Medicaid expansion, all while maintaining a very healthy ending balance. However, most importantly, this budget protects services that our communities and businesses need, not only to recover from this pandemic, but to emerge from it stronger than ever. And with that, I'll hand it over to Dr. Lee Norman, Secretary of Kansas Department of Health and Environment.
I had a call again this week, and I've commented oftentimes on the hospital calls. And last week I had the larger hospitals, the tertiary quaternary care hospitals, and yesterday the smaller hospitals, the critical access rural hospitals. And it's really encouraging what I'm hearing, and that is, especially as we hear about the coasts and other areas of the country being overrun by patients, number one, with patients in hallways and the like, and then number two, with staff shortages. We are seeing neither of those in the state of Kansas. There's ICU beds available, the majority of ventilators are available, and very encouraging, the staff are coming back off of isolation because of illness or quarantine, and it was just a good sense of calm. So number one, it's really gratifying to see our healthcare workers get a little bit of a reprieve right now. We hope we won't see a continued increase post New Year's holidays, because that's still within the time frame of where we are now. And to the governor's point, we cannot let our guard down. Secondly, the vaccine, as the governor pointed out, are getting in people's arms, especially into healthcare workers and EMTs and paramedics and the like. And there's just such a sense of relaxation. They're not letting down their guard, but they feel like there's progress being made, and then they're seeing that in the work setting as well. So that's the hospital update for the week. I thought you'd find that beneficial. That's into my prepared comments.
All right, questions? Governor, I have a question. Some states are starting to roll out extended benefits payments for unemployment insurance payments, with others set to begin kicking out sometime this week. Where's the state on extended benefit payment rollout, and what's causing the delay?
You know, I honestly cannot give you a clear answer on that because I've not talked with labor this week. One thing I do know, though, is that backlog that had been up at 25,000 has gone to about 750 or lower. So we're making tremendous progress on that. I'll check on the new federal unemployment money and find out where that is.
Governor, the House Majority Leader, speaking of your budget, the House Majority Leader described it of a Medicaid expansion, the Netflix tag, so-called, and the CAPERS proposal. He called it, quote, a trifecta of things that aren't going anywhere. Your response to that?
Well, I sort of expect that. You know, that's sort of the initial shot off the bow, you know, because that's where you start negotiations. We're here, you're here, and we come together. So it's not unexpected.
I did want to ask you, in your State of the State last night toward the end, you mentioned the failed insurrection in Washington and the mob violence there. There have been warnings from the FBI that there are plans just generically for armed demonstrations at all 50 state capitals. What do you know about that, and what is the state planning to do?
Well, we are very well aware, and we are keeping a close eye on, and we will step up security precautions as necessary, but we really can't discuss the details.
Any plans to call for guard? Anything?
Like I said, we really cannot discuss the specifics of the security plan, but you can trust that the folks who are responsible for that are all over it.
Governor, last night you sort of alluded to proposals previously that you vetoed on taxes, and you specifically said you didn't really want another Brownback 2.0 tax plan. Is there a tax plan that you don't define as, quote, Brownback 2.0 that you would accept from the legislature?
Well, I can't really respond to a hypothetical. You know, I need to see.
Like itemization, for instance, that whole issue. Is that something that you would accept?
You know, I'll have to see it, and I'll have to see how it fits in with everything else. You know, I never like to just shut down and say, absolutely, I won't accept something. I mean, there are certain things that I won't, you know, like the income taxes, you know, the Brownback tax experiment is completely unacceptable. We know what that did to our state, and we can't let that happen again. What the legislature presented last year was too much, and it would have really started to take us back into the Brownback era, and I couldn't let that happen. That's why I vetoed it. I haven't seen anything from them this year, though, so let's leave that open, and we'll see what they present, and we'll sit down and have a discussion about it and see if there is anything.
Last year still is out of the question again, this year no.
If it came back in the same form, I believe it would be.
Is that also the case with the property tax, so-called property tax transparency bill that they did?
You know, I think the issue with the property tax transparency bill wasn't so much that it was a transparency bill, which I completely believe in, or it was purported to be one, or that it lifted the cap on our counties, which I voted against originally. So I would actually, there was a lot in there that I really liked. I think the problem with it, if I can remember correctly, was the amount of administrative hoops and work that it would have put our counties through. And I tend to avoid those kinds of things. I don't like to push that kind of unnecessary work down onto local elected officials. So I hope when it comes back this year that those issues have been taken into consideration.
I have a quick question for Secretary Norman.
Okay.
I know that KDHE was scheduled to attend the Senate Public Health Committee. What was the reason that you guys weren't able to attend that in the end?
That was, the question is about the Public Health Committee, was that we got a whole lot of vaccine in and a whole bunch of distribution going on, and we do not want to have delays getting it into people's arms. That's an all-hands-on-deck day, and it was just a question of timing.
Dr. Norman, our Kansas City station wants to know how we'll be releasing all vaccines in Health Kansas. Specifics on when will the state get the doses, when will it be available for people in groups 2, 3, and beyond, and will the doses go to health departments or private pharmacies?
Yeah, that was really three questions, I guess. Operation Warp Speed, the answer is don't know, don't know. And we're at a very awkward time right now with an outgoing president and an incoming president, and we've had no guidance from the specifics of that. We would love to have more vaccine come to the state of Kansas. We would love to know in order of magnitude how many doses are going to be coming to the state of Kansas. As the governor pointed out, we have lots of, in addition to the 278-ish vaccination sites right now, we have a lot more providers signing up and being trained on WebIZ so as to be able to respond. So it'll be just a question of timing and how much comes in. It's very possible, quite honestly, that the feds, when they release those additional doses to us, will, for a moment in time, be put in freezers here rather than in their freezers until we have it all worked out on the very specifics for an orderly distribution and administration of those doses.
Do you know what time mass vaccine clinics will begin?
As soon as the question is mass vaccine clinics, and we can start those when we get enough vaccine to merit it. We already have sites that are vaccinating that can do 1,000 to 1,500 vaccines a day, and without necessarily setting up what we call a mass vaccine clinic, extended hours and that kind of thing. And as you can imagine, with 17,000 doses a week, for example, coming into the entire state, there's no need for a mass vaccine clinic for that. That's within our current wheelhouse of expertise. It's when we get, and I don't know, from Operation Warp Speed, we just haven't seen that yet. And I don't know if that's going to be coming from the current president or the next president. We don't have that clear answer yet.
Norman, are you planning to reschedule those committee hearings with
We'll be testifying next week.
Dr. Norman, there some, I don't know that I'd call them reports, but some question about whether there are still a few rural hospitals, I think the number I've heard is 6, that haven't gotten any vaccine.
There were some, and I don't know if it was the hospitals per se, there were some vaccination sites that haven't requested vaccine, and we don't send it to those that are not requesting. I'd have to get more information on which hospitals those were. I know it's in every county, and but I don't know. I haven't seen that yet, but I can find that out.
Okay.
Governor, question for you. Last week, very quietly, you got together with 7 other governors and sent off a letter to HHS in which there were some rather strong suggestions in that letter about the Trump administration withholding doses of vaccine. Can you talk a little bit about your mindset about, why you joined in that letter? I mean, you're usually very reserved. That letter was very strongly worded. Can you talk a little bit about, your thoughts?
Well, I didn't write it, but I shared the thought. I mean, because the reality was that the federal government were holding back, 100 million doses or whatever it was. It was a lot. And, while we need vaccines, other states are really hurting. I think Michigan just put in a request to actually purchase 100,000 doses themselves. I mean, so a lot of the other states are even in worse shape than we are in terms of having enough vaccines to get people vaccinated. So I felt it important to stress that there really is no need to be holding those back. It appears that production of vaccines are going well enough that it's safe to release those. They don't have to be held back for the second doses. So that was all. I wanted to just encourage them to get them out, whether they get them out all at once or at least just start to increase the shipments to the states to meet the needs. I don't care. I just didn't want them to continue to hold them when so many states needed them.
Last question.
Governor, what do you make of the Republicans, the Republican Party, Republican legislative leaders continuing to suggest that Kansas lags far behind other states in distributing the vaccine? I mean, there's still that rhetoric out there that Kansas is the last, or next to the last, or near to the last.
Well, you know what? I just count on all of you here in the room to get the real information out there. I mean, the fact is that is rhetoric. It is not the truth. We are not the last. Did we have a problem with the lag between vaccinations and getting the information into the database? Yes, we have ramped up the work that we've done on that. We are now, in expectation of additional doses coming in. We are working very hard to sign up these additional providers so that when we get those vaccines in, we'll have a place to send them to get into people's arms so that we can start moving into phase 2 and moving through phase 2. So I just would appreciate it if, instead of reporting rhetoric, that you all check the facts and then, go ahead and talk about the rhetoric, but then fact check them.